This is chapter 21. It has to do with indices and scoring methods and risk factors. The types of scoring methods are for many different reasons. We have an individual assessment score whose sole purpose is for patient education, and you can use it for the patient to be able to recognize what's going on, for instance, with plaque, to motivate and educate, and also evaluate. So you can conduct a clinical trial to determine the effect of a particular agent or procedure on prevention or the progression or control of disease. This may be something that they want to conduct a clinical trial for, to see how a particular toothpaste is working, how a particular medicament is working, which is something that they might, some type of antibiotic, or that is supposed to help heal the periodontal pockets. And so basically, anytime they try something new or want to evaluate a process that is currently used, they might try a type of scoring method, which they will call an indices. And indice, there are many different kinds. You're going to learn most of them in public health, so I won't go over all of them at this point, but we'll touch on some of them. So types of scoring methods would be for epidemiologic surveys. This is epidemiology, is the study of disease characteristics of different populations. Community surveillance, that purpose would be to collect data to determine health status by conducting screenings at different schools or community health facilities. They assess the needs of community to plan promotional or disease prevention programs. It can be used for many different things. So an exact definition of an indices is an expression of clinical observations in numeric value. So they put a number on what you're observing when you, if it may be, you want to observe how much plaque is in a person's mouth, how much calculus is in a person's mouth, etc. So you want to describe the status of an individual group being measured. You have to have a standardized method for interpretation. It is less subjective than just a word description. So in order to have these, it's almost like a science project where you have a control and then you have a standardized way of that you're going about every single screening or clinical observation that you're doing, so that you have something set. Description categories of indices. You have general categories. You have a simple index, which measures the presence or absence of a condition. You have a cumulative index, which measures present and past of the condition. And so you have a simple and a complex indices. You have irreversible indices, which is a way of conducting maybe dental caries because it's irreversible, or reversible, such as plaque, because through education you can learn to take the plaque off in a better way, and so that its situation can be reversed. The selection criteria, no matter what you choose, needs to be simple, needs to be free, no pain, it should be valid, and reproducible and uses a minimal amount of time. A plaque control record. We record biofilm on individual tooth surfaces to permit a patient to be able to see. And when they see what's going on, that's their awareness. And they get more interested in their home care. So the selection of teeth and surfaces, we do all the teeth in the plaque control record. We do 4 surfaces are recorded: the facial, the lingual, the mesial, and the distal. The occlusal is not included. 6 areas may be recorded. CONCORDE uses 6 areas. Other indices may just include 4 different areas. So a procedure for this is, first of all, on a sheet that is going to show all of the teeth. You're going to cross out any missing teeth, crowns, veneers, implants, and bridges, because we do not put a plaque liquid on restorations. So we will dry the teeth off. We'll put a few drops of disclosing agent into a dabbing dish. We're going to saturate a cotton tip applicator and cover all the surfaces of the teeth with this disclosing agent. Then we're going to evaluate the biofilm on the cervical 1/3. So we don't take any recordings from any of the stain that is on the middle or the incisal edges of the tooth. It's all up by the gum. So we're going to examine each tooth for markings of biofilm or plaque. We're going to record the location of the biofilm by making a dash or coloring in the appropriate space on our control sheet. So it's either going to be facial, mesial, distal, or lingual on the facial and lingual of all teeth. The formula to get our score is always right here on the sheet, so that makes it nice and easy. We take the total number of tooth parts with biofilm and over 6, because there's 6, every tooth is divided into 6s. So we'll take 6 plus the number of teeth present. So this is how we're going to do this. First, we're going to mark out all the missing teeth. So let's say that they don't have, whoops, not real great with this mouse. Let's say they don't have their wisdom teeth. So we're going to mark those out. So that leaves them 28 teeth left. So let's say that you find biofilm here by the cervical. You find it in these 2 spots. You find it in these 2 spots across that whole front and there. So let's just take those for just our example. So we're going to take the total number of tooth parts with biofilm, which will be 2, 4, 6, 7, 8, 9, 10, 11, 12. We're going to have 12 spots with biofilm. Then we're taking 6, dividing each tooth into 6. So we have if you were looking at the facial, which is always on the outside, lingual is always going to be on the inside. So you would have, of number 8, you would have this facial, lingual, and here would be the mesials on both sides and the distals on both sides. So we're going to erase that because those are not in our number. Okay. So now we have that. So 6 times the number of teeth present. So we take 6. These are missing, so there's 28 teeth present. I'll get a calculator here real quick. So that's 168. So you can take 12 times 100, 168 times 100, or you can just skip this times 100 business and just take 12 divided by 168. It's going to be 0.07 hundredths. Which would be 7%. And that's the score. So that's how you get your number. So this will always tell you how to do it. Now, right now, during COVID, we are not doing this particular sheet of paper. We're trying to cut down on paper. So we will be advised through this course of when we can start this again. So here's another example. I marked quite a few more teeth with the pencil. You'll use usually it's red because it's biofilm, should not be there. So this is an example of timesing it by the 100 to get the 15%, or you can just do it the shortcut way. So plaque control record, the scoring, this is going to give you exactly what we did and the directions, just so that you have them in black and white. So how do you interpret this? So of course, if you get 0% plaque, that's ideal. Less than 10% biofilm stained surfaces have been suggested as a guideline for in periodontal therapy, which is when a patient has reached 10% level of biofilm control or better, additional periodontal and restorative procedures may be initiated. Okay, so if they are the best and ideal would be 0, but if they're less than 10%, that's what we want to keep them. And when it says a guideline in periodontal therapy, it's to be able to show the patient how much biofilm is in their mouth and do the calculations, and that we want to keep it below 10%. And if it gets above 10%, then maybe we have to clean the teeth more often, or we have to, maybe they have a overhang on a particular, some of their older restorations, and that is what is holding the plaque and biofilm there. So restorative procedures may need to be initiated and to either remove and replace those old fillings or restorations, or we just remove the overhangs or whatever is causing the issue. This is a debris index. This is just to show you, there are just so many different indexes. Each number would be counted as one surface. And this is the same as it would be for plaque. So if you have nothing, you wouldn't count it, of course. If you just have a little bit of debris, which is the plaque, up by the gum, this is what we're going to pay attention to. That would be considered one surface, because this would be the facial. This is the facial, this is the facial. So it's all considered one, even though there's varying amounts of plaque on the teeth. You're just going to count them the same as one. So you have something, you have a tooth that just has a teeny little bit right here, that you count that as one. This would be a calculus index sample. They will use these as the, how that kind of is their barometer. So if a tooth doesn't have any calculus, it would be 0 if it's up by the gum line. If it's on at least half of the tooth, half of the facial, and underneath there's little spicules, it would be a 2. And if it's over most all of the tooth, and you put your Explorer underneath the gum line and there's this band, very often happens on the molars areas, then you would count that as a 3. So you can have papillary marginal attached index, which is called a PMA by Schauer and Massler. Periodontal index, which is called a PI by a guy named Russell. And there are other indices for just patient instruction alone. And I wanted to show you this. This is called a WHO probe for World Health Organization probe. And it's used for an index called a PSR. Some offices use a PSR. It's just a different way that they divide the tooth up. Mainly in a PSR, they will take divide the mouth up into quadrants. And so you will take you'll just randomly choose, teeth in a quadrant, like maybe 2 teeth in each quadrant, and whatever those 2 teeth would, however much plaque that they would have, you just score the entire quadrant that way. So it's a quicker way to do screenings of plaque control. So the difference of this WHO probe and how you can tell what it is there's this ball at the end. So this is to help so that it's not so pokey, and sounds like a really great idea, but they're actually a little bigger than what it looks like. If you have a really tight, thin, narrow pocket, it's sometimes hard to get that underneath the tissue. But it does its scoring about just above this little ball is 0.5 millimeter, and then it goes straight up to 3.5 millimeters on this, and 5.5, 8.5, and 11.5 millimeters. A periodontal screening and recording, that's what the PSR stands for. So it's going to assess the periodontal health. Once again, they divide the teeth into sextants. There's a bleeding index. One is by Eastman Interdental bleeding index. They will take a little wooden wedge that you soften with the saliva at the very tip. It's actually for an aid, home care product aid that some people like, especially if they have large spaces in between the teeth. So what you do is wet that, and you go in between each one of those teeth, just in and out. And then when you take it out, you'll see how much bleeding that there is, or if there is any. The CONCORDE clinic bleeding index that we do is bleeding on probe, which is your BOP. We record bleeding sites when we're doing perio readings. The Dentrix will add the numbers together, and you can figure the bleeding site percentage from those numbers. And then we will give our patients a PI, which is a plaque index percent, and a BI, which is a bleeding index percent. So basically what we're trying to educate our patients and the community over, if you're doing a plaque index screening out in a community-based project, you're wanting them to see in the mirror. You're wanting to motivate them to see that this is a real thing, that they can brush their teeth as well as they think they are. You put on a plaque disclosing agent on there and give them a mirror to let them see what sites that they're missing. And that's really the best motivator if you need to give them different types of home care aids to help in this, different types of apparatus for flossing, or the wooden picks, or a stimulator, a gum stimulator. This would all help in them knowing how to use it and what they're going after.